American Society for Gastrointestinal Endoscopy (ASGE) recommended that the combination of benzodiazepine and opioid is a safe and effective regimen for achieving minimal to moderate sedation for upper endoscopy and colonoscopy in patients without risk factors for sedation-related adverse events. First, let's talk about benzodiazepines, namely midazolam and diazemuls. What are they? Midazolam and diazemuls are commonly used benzodiazepines in procedural sedation. Midazolam is water-soluble benzodiazepine, while diazemuls is a special form of diazepam that dissolves in the oil phase of an oil in water emulsion. How do they work? Benzodiazepines act by helping the binding of gamma-aminobutyric acid, in short GABA, at GABA receptors in the central nervous system. GABA is an amino acid which serves as the major inhibitory neurotransmitter in the brain and the spinal cord. GABA reduces the excitability of neurons and thus produces a calming effect on the brain. Midazolam is short-acting, roughly 2 times as potent as diazepam, and it has a greater hypnotic effect than diazepam because it interferes with GABA reuptake. Diazemuls and diazepam are long-acting, medium potency benzodiazepines. There were several comparative studies on midazolam and diazemuls in sedation for endoscopy. In 1983, a randomized double-blind trial was presented in British Journal of Anesthesia that midazolam was compared with diazemuls as sedation for outpatient gastroscopy in a randomized double-blind fashion. There were no differences concerning speed of recovery, and all patients were considered ready for discharge after 2 hours. With the same degree of sedation, midazolam produced a higher frequency of amnesia for the endoscopic procedure. A systemic review and meta-analysis was published in 2008 that 36 studies with the number 3,900 patients were included. Sedation improved patient satisfaction and willingness to repeat upper endoscopy versus no sedation. Midazolam provided superior patient satisfaction and less frequent memory of upper endoscopy versus diazepam. When and who? The onset time of midazolam and diazemuls are within minutes. They take hours to be eliminated. Effects of benzodiazepines are dose-dependent. However, receptor saturation can produce a ceiling effect. Midazolam and diazemuls are contraindicated in patients with acute angle closure glaucoma and severe respiratory depression. Acute angle closure glaucoma is an urgent but uncommon dramatic symptomatic event with blurring of vision, painful red eye, headache, nausea, and vomiting. Drug interaction is another issue with benzodiazepines, which are metabolized in the liver while the cytochrome P450 and subsequently detoxified and finally excreted via renal system. Carbamazepine, phenobarbital, and phenytoin, which are enzyme inducers, may enhance the metabolism of benzodiazepines and thus decrease serum level. In contrast, antifungals and some antibiotics of enzyme inhibitors affect benzodiazepines metabolism vice versa. Recommendations for further reading: it is recommended to read both guidelines for sedation from Hong Kong Academy of Medicine and American Society for Gastrointestinal Endoscopy (ASGE). Summary: midazolam and diazemuls are commonly used benzodiazepines in procedural sedation in endoscopy. What are they? Benzodiazepines. How do they work? GABA inhibitory. Why to use? Evidence-based medicine. When and who? Remember their onset, duration, elimination, contraindications, and the cautions. Thank you.